5 types of arthritis and how to tell the difference. Throughout your life, you've probably heard an aging person joke about their stiffening joints. "I'm just getting old," they'll say. To an extent, there is truth to that remark. Even so, as you age, realize that joint pain is still not a normal part of life. You should not dismiss it, since painful joints may mean the onset of arthritis. In addition, by catching the problem early, you could save yourself a lot of unnecessary pain. In the United States, over 50 million people suffer from arthritis, according to the CDC. A huge number of these, 60%, are between the working ages of 18 and 64. Many sufferers find difficulty in performing essential job tasks, and in some cases, their condition keeps them from working at all. Aside from the economic effects, arthritis can also prevent people from getting adequate exercise and can significantly reduce the quality of life. Which type of arthritis? To deal with arthritis properly, you should first work with your doctor to find out which type you or your loved one has. While there are over 100 different types possible, most Americans suffer from only a few. 1. Rheumatoid arthritis. According to the Arthritis Foundation, over 1 million Americans suffer from rheumatoid arthritis, RA. This condition is actually an autoimmune response, meaning that the immune system is attacking the joints or parts of the body that affect the joints. As the immune system attacks, the joints get damaged and inflamed, causing an array of problems for the sufferer. Symptoms include pain and stiffness in major joints like the hands or legs, swelling that lasts for hours, fatigue, appetite and weight loss, or joints that feel warm to the touch. The pain is usually severe and can last all day for some people. If you're experiencing this type of joint pain, you should see a doctor immediately. Because of the immune response, RA can affect other vital organs in the body. 2. Osteoarthritis. Osteoarthritis, OA, is a highly common type of arthritis, so common that most people are referring to OA when they talk about arthritis in general. According to the CDC, nearly 30 million adults are suffering from this condition in the U.S. How does OA happen? It occurs when a joint in the body begins breaking down because of wear and tear, often due to aging, injuries or obesity. Usually, people get OA in their knees, hips and hands, and the condition happens over time as the cartilage wears down. Symptoms include stiffness in the morning or after long rests, aching pain, pain when walking, bending or gripping objects, swelling and a joint that is warm to the touch. Because symptoms worsen slowly, you may notice the pain come and go. 3. Gout. Another common type of arthritis is gout. This type usually affects men and those who are obese and is caused by an increase in uric acid in the body. Unlike other arthritis types, gout will flare up for a period and then go into remission for months before another flare-up again. If a person gets regular flare-ups, they may eventually find the gout worsening into gouty arthritis. Symptoms include intense pain, redness, swelling and heat around the joint. Also, it usually affects one joint at a time and occurs in weight-bearing areas like the big toe, ankle or knee. 4. Juvenile arthritis. Juvenile arthritis, JA, is actually an umbrella term that refers to arthritis in children under 16. JA is usually caused by an autoimmune response, although experts cannot find a clear cause. Different types of JA can affect a child's entire body or specific areas like the tendons. Typical symptoms that parents should watch for are stiffness, swelling and tenderness, rash, limping, eye redness and vision problems, irritability and a persistent fever. 5. Psoriatic arthritis. Finally, many patients are suffering from psoriatic arthritis. According to the National Psoriasis Foundation, 30% of all those affected by the skin condition will also suffer from psoriatic arthritis. Those affected usually get psoriasis first, a skin condition that causes scaly, raised, red and white patches of inflamed skin around the body. This condition can then lead to inflammation in the joints, causing arthritis. Symptoms include swollen joints, especially the fingers and toes, discolored fingernails, swelling and sometimes back pain.
10 Best Foods to Fight Arthritis and Joint Pain. 1. Oranges. Oranges and other citrus fruits are a great source of vitamin C, which is a basic constituent in the synthesis of collagen. Collagen helps to repair ligaments, bones and blood vessels. People with osteoarthritis, which is a major cause for joint pain, should include oranges in their daily meals. 2. Nuts. Most nuts contain vitamin E, calcium and fiber. These are known to fight inflammation. Nuts like almonds are essential in Mediterranean diet, which is known to curb inflammation in just weeks. Consider incorporating different types of nuts in your diet for you to reap the full benefits. 3. Pomegranate. Pomegranate is a rich source of antioxidant polyphenols, anthocyanins, carotenoids, vitamin Z and C. Pomegranate helps to reduce inflammation by blocking the active inflammatory agents which are responsible for cartilage degradation in osteoarthritis. Fresh pomegranate juice can be consumed regularly as a choice of healthy drink. Alternatively, you can also add pomegranate seeds to salads and desserts. 4. Ginger. Ginger contains high amounts of the super healthy compound, gingerol. It likely contributes to its anti-inflammatory and analgesic properties, which are similar to those of non-steroidal anti-inflammatory drugs, but without the side effects. A research that was carried out on patients who were suffering from arthritis and muscular pains both demonstrated significant outcomes in pain relief and muscle swelling. 5. Cherries. Cherries are one of the best loved and most well-known fruits for relieving arthritis and overall joint pain, even in those without arthritis. They're great to consume post-workout or whenever you're just feeling achy. Keep some frozen cherries in your freezer throughout the year so you can use them in breakfast dishes, snacks, and desserts. Their anthocyanins, antioxidants, are what give them their tremendous healing powers and can also be found in all types of berries. Try them in this yummy cherry smoothie as a delicious way to enjoy them. 6. Green tea. High in nutrients and antioxidants, green tea is known to reduce inflammation. Studies performed on animals also found that it can help reduce the incidence and severity of rheumatoid arthritis. Aim for 2 servings a day, either hot or cold. Be sure to use tea bags, not the powdered tea mixes, which are more processed. If you drink the decaffeinated variety, make sure the process is all natural. 7. Turmeric. Turmeric contains curcumin, which has anti-inflammatory properties that protects tissues of the body from destruction and joints from inflammation. It is recommended to take turmeric with black pepper. The piperin in it triggers the release of curcumin from turmeric. 8. Broccoli. Broccoli is packed with calcium, protein, anti-inflammatory antioxidants, and vitamin C. Vitamin C can help reduce pain, lower physical and mental stress, and will also help keep the body's immune system working well. Thanks to its anti-cancer compound known as sulforaphane, broccoli also has the potential to prevent or slow the progression of osteoarthritis. Even more, it's also a good source of vitamin B6 to assist with energy and a healthy mood. Try broccoli in this anti-inflammatory quinoa salad, or use broccoli sprouts in a superfood salad. 9. Olive oil. Olive oil contains a natural compound called oleocanthal, which may help prevent arthritis-related inflammation. This compound blocks the same inflammatory pathways as ibuprofen and aspirin, medications commonly used to fight arthritis pain. For the highest antioxidant content, choose extra virgin olive oil. 10. Cinnamon. Cinnamon has been used for thousands of years as an effective natural remedy for arthritis. Arthritis is essential inflammation of the joints, which causes pains in the muscles around the joint area. Due to its anti-inflammatory benefits, research shows that cinnamon can be effectively used to treat rheumatoid arthritis. For treating, you can mix honey and cinnamon powder in warm water and enjoy the drink.